So we're here at Health Hack Day. What is health to you? Is health the same as not being sick? Is health the same as not having a cold? Is health the same as not having a broken arm or leg? Is health maybe the same as being able to walk and talk? Or is health maybe the same as being able to trust your body to do what you ask of it, what you want it to? Maybe is health the same as not being dependent on medications every day? I think a lot of people take their health for granted. We have a Swedish expression, hälsan tiger still, meaning health is silent. And I think that's the way it is for a lot of people. When you're healthy, you don't care about your health. You don't worry about it. You don't talk about it. Health is silent. Well, for me, health is not silent. For me, health is an active choice. For me, health is something I fight for, something I have to fight for. Every hour of the day, every day of the week, every week of the year. Besides being a researcher at Karolinska, I have Parkinson's disease. Parkinson's is a neurodegenerative disorder, which means it's related to the brain and it keeps getting worse. And currently there is no cure for Parkinson's disease. There are over 4 million people all over the world with Parkinson's disease, and we each struggle with our own combination of symptoms and medications. And the most common visual signs of Parkinson's disease are slowness of movement, stiffness, problems with balance and gait, posture and gait. And for about 75% of us, there's the characteristic Parkinson's tremor, which I don't have, so I'm of the 25%. But besides these visible and motor symptoms, there are a lot of other symptoms we have to deal with. They're called non-motor symptoms, and they deal with sleep, cognition, digestion, other autonomous system functions, depression, and others. These are not as easy to see, but probably more difficult for the people experiencing them. So Parkinson's is a very individual disease, and the treatment available can only treat the symptoms. It doesn't affect the progression of the disease. And the treatment available is medications. These are my medication. I take 6 different types of medications, prescription medications, 6 times a day, in 6 different combinations, with 6 different time intervals. And without these pills that I have in front of me, but without every single one of them, probably I wouldn't be able to walk, I wouldn't be able to work, I wouldn't be able to function, I wouldn't be able to take care of myself. I would definitely not be standing here today if it wasn't for these medications. But I'm also an engineer, so I wanted to know more about the effects these medications have on me. So for me, these medications are input into a process, and I'm the process. And I wanted to know the output. So I wanted to know about variations over the course of the day. I wanted to know if I could see any patterns in this. And since one of my symptoms is slowness of movement, and that my fingers actually are a sign of how well I can move my whole body, I wanted to find out how the mobility of my fingers varied over the course of the day. So I did some pilot testing with a simple finger tapping app I found on App Store, a free one. I tapped for 30 seconds with my middle finger on my right hand and left hand for 30 seconds, as fast as I could, a number of times over the course of several days. And at the same time, I kept track of my medication intakes. And I found interesting patterns in this, things I didn't know before I did these tests. And so I wanted to, but this was not easy to do. I had to use 2 different apps and keep track of medications by hand, and then plot everything in Excel. It was a lot of work. So I didn't expect others to want to go through all that work to do the same thing. So I wanted to give more people with Parkinson's the same chance to try this, but in an easier way. So I was able to find funding from Vinnova, actually, to be able to develop a system for doing this in a structured way. And we have the project called Self-Care Academy. It's a generic system for personal health improvements in chronic disease. And the system currently consists of 2 apps, one for medication reminders and registration, and one for the finger tapping that we used. And we've started with the first user group to test this system, and they have given us good feedback, and we're looking at analyzing their results in a couple of weeks' time. But for me, this methodology of observing the different patterns and different aspects of my health and daily life in a structured way, because to me, having a chronic disease, living with a chronic disease, is very much about lifelong learning. And to me, going back to what Rajiv said, and also has been said earlier here today, health, for me, in chronic disease, health is not created in healthcare. Health is created in the other 8,765 hours, together with the input you get from healthcare. But you really create your health yourself. But so, using this methodology of tracking the aspects of my disease resulted in me learning a lot about my condition. Things I could and I did discuss with my neurologist at the last half-hour visit I had with him over the course of the year. And so that was an important aspect of what the system gave me. But more importantly, it gave me a way of finding patterns and variations. It gave me a way of putting things in the context of this complex things we call life. It made me being able to make sense of what happened. It gave me more control of my situation. And to me, the control of my situation, that's health to me. What's health to you? Thank you for listening.
Thank you very much. Thank you very much.
Don't come too close.
Stay away.
Yeah.
So, is there anyone out in the audience that has a question for Sara? No one?
No one wants to share what health is to you? Or are you saving it for the contest, maybe?
Do you have one?
Yes. Could I just ask, so how could we get patients more engaged in the development of these kind of applications? Because they know their needs, and well, perhaps we can guess their needs as developers or government officials or whoever we are, but still we need them to drive this change themselves. What are your advice to really encourage patients to really take charge of this development?
Yeah, so I know there are a few more patients in this room tonight, chronic patients, and I think that we could take the lead in this, and sort of together we could make this, not together with healthcare, but together with these kind of people, with the more innovative and more creative bunch, and not the ones stuck in the system. We need the system as well, but not to govern this, to support it, but not to govern it.
Okay.
I think you had a question there. Yeah.
Do we have another one?
Can you tell us a bit more about your self-care academy?
I can, but I'm on a schedule here, so anyone who wants to know more can come up to me at any point in this weekend.
What did your neurologist like about the application?
So he's one of the few neurologists who actually believes in shared decision making. So he liked it. So we looked at the results together, and we decided on the treatment for the next time together.
Great. Thank you very much, Sara.
Thank you.